Well, my name is Dennis Myko. I live on Lake Ponsent. My mailing address is actually Escalon, South Dakota. I'm retired. I spent something around 42, 43 years working as a consulting engineer for Banner Associates here in town, just down the street. I was diagnosed with Crohn's disease back in '84 and have been under medication for 30-some years. Occasionally it spikes on me, and I had an episode back in September that I toughed it out at home for 4 or 5 days, having done that numerous times over the 30 years I had the disease. But it just wasn't getting any better, and I was going downhill, and finally just decided I couldn't handle it anymore on my own, so we came into the emergency room. When I got to the ER, I was diagnosed as severely dehydrated in acute renal failure. I was kind of a hurting dude at the time, and so that was the reasoning. I've gone through these spikes a number of times, and it's usually maybe 2 days, maybe 3 days at the most. And after 5 days, I finally figured out that it wasn't going to turn around on my own. When I first came into the ER, the first test they ran was an ultrasound, and I have no particular knowledge of why they chose to do an ultrasound, what that was attempting to show, in terms of what they felt might be the diagnosis. But during that ultrasound, apparently they picked up some spots on my liver that I guess became increasingly a concern, going forward. There was a CAT scan, and then a second CAT scan. And I think the second CAT scan was with some intravenous fluid that would highlight the scan more so than the original one. And then ultimately an MRI was recommended, to get more detail in terms of the imagery. They just treated me so well. And of course, it requires an intravenous connection, and, they just handled it so professionally. Instructions were clear, and the gal said, "We got good pictures," so that was the ultimate result. And I guess the one thing that I observed probably more than anything is just how caring people were here. And that doesn't mean that they weren't caring in other places where I've been, but I particularly noticed it here. As it turns out, I probably would have never known of the liver spots that were identified had I not had the Crohn's episode. A blessing in disguise, I think, is a term we've used several times, that we found something early that appears like can be treated. Like my wife says, if we had waited until you started, having yellow eyes and yellow, face, we probably would have been too late, to do much of anything. The thing that I appreciate most is that it's local. I live out at Lake Ponsent. It's an hour and a half to Sioux Falls. It's a half hour here. And to know that the care, I guess, in terms of my needs recently, were handled here just as well as any of the medical facilities in Sioux Falls. It's just nice to know there's the kind of expertise and care locally.